economic update promises continued help for the provinces to manage the COVID-19 outbreak in long-term care homes. Key to that is a promise of $1 billion in funding to the provinces to protect people in the long-term care homes. Is that good enough? Laura Tamblyn Watts is the president and CEO of CanAge, a seniors advocacy organization. She joins me now. Laura Tamblyn Watts, good to see you again. How satisfied are you with the measures that you heard in this fiscal update from Chrystia Freeland today?
It's a good day for seniors, and really we're starting to see some significant investment in long-term care. So it's important to know that this $1 billion is for really COVID response, which can help with some bricks and mortars problems. And then there's an additional promise of national long-term care quality standards, which currently doesn't have money tethered to it, but we look forward to that in a future budget.
The money, the $1 billion fund that the government talked about today does have some strings attached. They want to see spending plans. Essentially, the provinces will view this as the government dictating how the money is going to be spent. So, we could be in for a bit of a war over this. How do you hope this thing goes?
We've been asking for strings to be attached, and we're actually very pleased to see that it does require that it be used for these purposes. Historically, we have seen health transfers go to provinces for seniors care, like we saw in 2017 when ostensibly millions of dollars were transferred for home care, but no real results were realized that anyone could actually touch and feel. So we're very pleased to see these strings attached. And I think that some provinces, and I mean, historically, we're looking at Quebec and Alberta in particular, may be concerned about that. But I think they're going to have to answer to their constituents. Their hearts were breaking and their hands were wringing, asking for federal funding for long-term care. I think it will be hard for them to say that they don't want to use this fund. Right.
It may not come to that. It may end up being a standoff over negotiations over what a spending plan looks like. In terms of this measure and other measures that the government has put forward, some of that outlined in this plan, what else can you tell us about, how this is a step forward for not just long-term care homes, but for senior care in this country?
We've needed significant investment in long-term care, and this is a start to what we need to see for things like national long-term care standards, but it really can actually make a difference for infection prevention control. Every day that we don't have these funds, we're losing lives, whether it's partners, spouses, friends, neighbors, parents. People are dying in long-term care, and it's not the time to be pointing jurisdictional fingers at anyone. It's the time to invest this needed money in the quality care supports that we know it has to go to. Infection prevention and control, testing, PPE, they come at a very high burn rate. And on the whole, long-term care facilities have been spending 2 to 3 times the amount of money that government has provided for infection prevention and control. In many ways, this money is a bit of a bailout for long-term care homes, but there's enough money to make some really positive investments as well.
Would you have liked to hear more perhaps about, we didn't hear much about health transfers, and we know the provinces are asking for more funds that would, they say they would pour into long-term care and everything else that the federal government needs to provide. Needs to enrich those transfers that could be used for all kinds of things, the provinces say, including better pay for long-term care workers in those facilities, all of those things. This is a move forward, you would say, but how much more is still to be done to try and correct some of these deficiencies in the long-term care system?
We think of this money as kind of emergency COVID money. It's not actually going to fix the entire long-term care system. And that's why we need to implement any one of our myriad reports on how to support seniors in Canada across the health and housing continuum. We know how to do that. That's going to be a next step. I think of this as an emergency response, which is long overdue to supporting COVID-19 and long-term care. It doesn't take away from the need for federal transfers for health. It doesn't take away from the need to have a proper human resources strategy, but it does nudge in those directions. So it's a good investment. What we have seen, though, is historically when the federal government has targeted money for seniors, it doesn't usually end up going there. It goes into acute care pockets. So this is important that the money be tethered. And based on what we've seen in long-term care and the number of lives lost, I think it's very hard to say that this money isn't needed.
All right, Laura Tamblyn Watts, thank you for joining us tonight. Good to talk to you again. We'll talk again soon.
Thank you. You too.